Welcome to the Skilled MBA Business Ethics Case Study Series, where we explore real-world dilemmas that challenge leadership, governance, and social responsibility. In this case, we turn to Peru, during the height of the COVID-19 crisis, where the distribution of the Sinopharm vaccine became a test, not just of logistics, but of ethics. While clinical trials were still ongoing, reports emerged that influential individuals, including politicians and elites, had received early access to vaccine doses outside of official protocols. This revelation ignited public outrage. Why were the powerful being protected ahead of frontline workers and vulnerable populations? This ethical dilemma goes beyond national borders. It forces us to ask, in times of crisis, how should access to life-saving resources be managed? Should influence override vulnerability? This case underscores the urgent need for clear ethical frameworks, transparency, and public accountability in healthcare decisions, especially when trust is fragile and lives are on the line. The Sinopharm vaccine trial in Peru highlighted significant ethical dilemmas. Distribution decisions favored elites, sparking outrage. Analyzing this through ethical frameworks reveals failures in justice and equity. Crisis leadership was tested, with decisions made under immense pressure, leading to severe consequences. This case underscores the importance of ethical leadership in healthcare crises, offering critical lessons for future challenges. In 2020, Peru experienced a severe COVID-19 outbreak, leading to the highest per capita death rate globally. The healthcare system collapsed, with oxygen shortages and overwhelmed intensive care units. Political instability, marked by 3 presidents in 1 week, compounded the crisis, highlighting ethical challenges in vaccine access amid infrastructure weaknesses. The Sinopharm vaccine trial at Universidad Peruana Cayetano Heredia, led by Dr. Germán Málaga, began with 12,000 regulated doses. However, 3,200 unregistered courtesy doses were secretly distributed to government officials and diplomats. This covert vaccination led to a scandal when journalists exposed the unauthorized actions, causing national outrage. The core ethical dilemma centers on resource allocation. Who should receive priority access to limited vaccine doses during a pandemic? Should influential individuals be prioritized over frontline workers and vulnerable populations? Medical professionals face the challenge of adhering to protocols while under political pressure to bend these rules. Dr. Germán Málaga, a lead researcher, managed vaccine distribution, administering doses to VIPs without transparency. President Martín Vizcarra secretly received a vaccine, claiming to be a volunteer. Government officials, including ministers and diplomats, gained preferential access, leaving frontline workers unprotected. Peruvian media exposed the scandal, sparking public outrage and prompting a governmental response. Kantian deontology examines if actions were universalizable, questioning if the VIP, very important person, vaccinations adhered to duty and principles. Utilitarian ethics evaluates if these actions maximized welfare. Justice theory scrutinizes resource allocation fairness, while virtue ethics assesses the integrity of decision makers. These frameworks guide us in evaluating healthcare decisions amidst crises. Beneficence emphasizes acting for others' benefit. Were decisions made to protect those most in need? Justice questions if resource allocation was equitable or privileged. Respect for autonomy involves transparent information for informed decisions. Non-maleficence focuses on avoiding harm. Did preferential distribution increase pandemic harm? Crisis situations demand rapid decisions, often compressing timelines and amplifying consequences. Leaders may succumb to cognitive biases, favoring in-groups or preserving the status quo under stress. Healthcare professionals experience moral distress, torn between institutional demands and ethical standards. Transparency suffers as speed of action challenges proper documentation and disclosure. The scandal led to the resignation of the Minister of Health and triggered congressional investigations, severely damaging political careers. Legal implications include criminal investigations for abuse of power and corruption. Public trust in government and vaccine programs eroded significantly, while globally there was increased scrutiny and reassessment of vaccine trial protocols. The crisis response analysis reveals 487 individuals, including officials and family members, received unauthorized vaccinations. This led to 16 official resignations. Public trust in government vaccine programs plummeted by 78%. It took 3 weeks for a comprehensive governmental acknowledgement, highlighting the ethical challenges in crisis management and the exacerbation of the scandal's impact. Argentina's VIP vaccination scandal saw the health minister resign after allies received preferential access. In Spain, military leaders resigned for bypassing protocols. Brazil faced vaccine tourism, with wealthy citizens traveling abroad for early doses. These cases highlight global ethical breaches in vaccine distribution, underscoring universal challenges in ensuring equitable access. Ethical leadership demands transparent protocols and equity-based distribution. Leaders should develop crisis communication plans and accountability mechanisms to ensure fair resource allocation. Establishing ethical decision frameworks is crucial to maintain integrity and resist political pressure, ensuring justice and transparency in times of scarcity. Future leaders must establish ethical frameworks before crises, ensuring justice and transparency in resource allocation. Document all decisions meticulously, providing clear rationales. Proactive communication about constraints and choices is essential to maintain public trust. Prioritize systemic values, resisting pressure to favor the powerful when it contradicts ethical principles. Explore how Skilled MBA offers case studies that enhance ethical leadership skills. These resources prepare leaders for real-world dilemmas by simulating complex scenarios. Engage with these materials to refine decision-making abilities and uphold ethical standards in challenging situations. Thank you for reflecting on this global health dilemma with Skilled MBA, Journey to Success with Pride. We hope this case challenges you to think critically about equity, governance, and ethics in decision-making, especially when stakes are highest. Connect with us, mobile, +9187 553-00795. Email support@skilledmba.com. Website https://skilledmba.com.